Keith Whyte. I'm the founder and president of Safer Gambling Strategies, which is a strategic advisory firm for organizations, companies, and governments involved in gambling issues. Prior to that, I was the executive director of the National Council on Problem Gambling for 27 years, and I also served as director of research for the American Gaming Association. So I've had about 30 years' experience in problem gambling and responsible gambling issues. When I came into the gambling field in 1995, one of the things that really motivated me was the opportunity to sort of seize this issue. There wasn't a lot of national attention spent on problem gambling issues and people with gambling problems. I saw there was a real opportunity to elevate the dialogue and make sure that we were starting to talk about ways that we could really comprehensively prevent and treat gambling addiction in this country. So it's been an incredible journey. There's still a lot more we have to do, but I've been really lucky to be kind of at the ground floor of a lot of the developments in the modern responsible gambling field. One of the things that excites me about being an advocate for people with gambling problems is the opportunity to help erase some of the shame and stigma that they feel and bring public awareness, not just to the health profession and the medical community, but also to the broader public, because there's a lot of misunderstanding about the nature of this disorder. Many people, and even many medical professionals, don't see gambling addiction the same way they do as drug and alcohol addiction. But biologically, and psychologically in our brains, they're very much the same. My hope is that people with gambling problems will be able to reduce the shame and stigma that they suffer from and increase public awareness that problem gambling is a preventable and treatable disorder. It has the same biological and psychological roots as other addictions and should be treated as such. In 10 years, as we look back, it's my hope and actually my belief that Virginia is going to have a comprehensive set of prevention, education, treatment, enforcement, research, responsible gambling, and recovery services that basically are going to make sure that everybody who is at risk for a gambling problem or who has a gambling problem has access to affordable and available services in their community. And that we will have a cycle from prevention to treatment to recovery that is going to leave nobody behind and make sure that people with gambling problems receive the gold standard of care. There's more than enough money in the gambling industry. There's more than enough money generated by the state of Virginia to make sure that there are truly no gaps in the safety net for individuals and their families in the Commonwealth.